The coronavirus has spread on all continents. No other pandemic in the history of humanity has been so documented or had so much media coverage. 5 months after the start of this pandemic, the world seems to be in chaos. Talking about contagion of coronavirus has become synonymous with imminent death. However, is this disease as lethal as it is believed? Is this the worst pandemic that human beings have faced? To answer these questions, we must analyze the global statistics that the COVID-19 has left until today. The first data is the number of infections to date. The number amounts to 5 million confirmed cases worldwide. This number seems to be quite high. However, it is still far from reaching other diseases caused by viruses, such as HIV, which to date account for around 40 million cases on the planet. Much further away is the Spanish flu, that according to experts was up to 500 million infections in several continents between 1918 and 1919. But what about the number of deaths from this disease? The latest reports put the figure at 320,000 deaths, a figure that is also quite far from diseases such as the Black Plague, smallpox, the Spanish flu, or HIV. There is another data that is perhaps the most revealing: the mortality rate. Coronavirus stands at 6.4%. In other words, around 6 people out of every 100 infections died from coronavirus. This data shows that the disease has one of the lowest mortality rates that exists in the world. If we analyze other diseases, we will see that, for example, 20 out of every 100 infected die from malaria, 30 out of 100 die from leptospirosis, 40 out of 100 die from yellow fever, and up to 65 out of 100 died from Ebola in its different types. One last piece of data to analyze is the population groups by age that died due to coronavirus. Statistics show that from 0 to 69 years, the average mortality rate is 1.1%. The figure changes abruptly when analyzing the group of people between 70 and 79 years. The rate rises to 8%. People of 80 years or more, the rate rises again abruptly to 13%. This shows us that the most vulnerable population group are people aged 70 and over, and who also have previous or chronic illnesses. What happens to recovered patients? To this day, the figure amounts to 2 million recoveries recorded. However, many people have had the virus and have recovered at home, presenting mild symptoms, and some without even realizing that they were still infected. With all this data and acknowledging that the COVID-19 is not among the deadliest viruses on the planet, virologists and experts in the field continue to urge the maintenance of basic hygiene measures such as hand washing, use of a mask, and disinfection of spaces for daily use to minimize the risk of contagion. The coronavirus is here to stay, and humanity must adapt to coexist with this and many other viruses in the world.